Good morning. Today we're going to have a little conversation about allergies, and one of the most common questions that I get from patients is, what can I use over the counter to treat my symptoms, and how do I know what the best treatment is for what I'm experiencing? And many times patients can't tell between allergy exacerbation and a sinus infection, and that's often something that you require an evaluation for, but there are many things that you can do before you come to a physician's office to treat symptoms of allergies. So first I'm going to go through this little diagram that kind of explains in a little bit more detail what allergies are, because I think it helps us understand how some of the medications that we use to treat allergies work. So allergies basically are a response that your body has to something that it perceives as foreign. And allergies can either come in the form of breathing in something in the environment like pollen or dust mites or trees or dog antigens, or it can come in the form of eating something that your body perceives as foreign, taking medications, allergies to latex or certain chemicals that you can be exposed to. But by far in Louisiana, the most common allergies that we experience are environmental allergies. So our humidity carries antigens around almost year-round. So almost year-round there's something that could be triggering our allergies. But what we want to talk about today is what happens on the inside once we breathe in or inhale or ingest something that our body perceives as foreign. So on our little diagram, this little orange star is going to signify an allergen. So the allergen, we'll just say for example, is a grass allergen. So you breathe this grass allergen in on the inside of your nose, and on the inside of your body, that triggers some cells in your immune system to go on alert. Your body is recognizing these things as foreign, and it wants to try to protect yourself against these foreign antigens. So when you're exposed to this allergen, that causes a cell on the inside called a B cell to make IgE antibodies. And so these little green Ys are going to signify your body making these antibodies. So the first time you're exposed to an antigen, your body goes on alert, it makes these antibodies, but over time, your body gets more efficient at responding. So the first time you're exposed, you might not have a reaction, or the reaction might be small, but the second time you're exposed, your body is ready, and that's where you're more likely to have a more significant reaction. These IgE antibodies connect to cells that are part of our immune system called mast cells and basophils. And when the IgE antibody connects to this cell, it's sort of like putting up its armor around that cell, and it's saying, okay, next time I'm exposed to that antigen, I'm going to be ready. So that antigen comes along, say you breathe in the grass pollen again, and it connects to these IgE antibodies, and that causes this mast cell to degranulate, which means this mast cell is going to release inflammatory mediators, and those inflammatory mediators are the things that cause the allergic reaction. So some of the inflammatory mediators that you can release are histamine, prostaglandins, leukotrienes, cytokines. There's a list of inflammatory mediators that are released when the mast cell degranulates. So as your body becomes more exposed to that grass antigen, you get more efficient at releasing these inflammatory mediators. And then what these mediators do is they cause the mucous membranes to swell, they cause the blood vessels to dilate, and the goal is to produce mucus to try to remove or make a wave of fluid that removes or clears out the antigen that your body perceives as foreign. So the problem is, as this system goes on, it can cause symptoms like sneezing, itchy watery eyes, nasal congestion. For some people who have symptoms that are more extensive, or asthma, it can cause a cough, it can cause shortness of breath, it can cause cutaneous manifestations like itching and hives. So we do want to try to prevent a small reaction from becoming a larger reaction. So then it comes down to, what do we do? What do we do to treat these reactions? So the first thing that many people try is an antihistamine. So histamine is one of the first inflammatory mediators that is released. It is part of what we consider an acute phase reaction. So you breathe in the antigen, your body releases histamine. So if you take a medication like Claritin, Allegra, Zyrtec, Benadryl, that's trying to block the histamine that has been released by this mast cell. So many times people will say, I've tried antihistamines or I've tried multiple over-the-counter antihistamines and I still have symptoms. Well, that could be because some of these other inflammatory mediators are not being blocked. And so then we get into the realm of nasal steroids. So nasal steroids can block some of these other inflammatory mediators, and an antihistamine, when you take it, can have an onset of action of about 20 or 30 minutes. And it can definitely treat part of the acute phase reaction, but sometimes you're exposed to, say for example, the grass again, but then over time you continue to have nasal congestion, you continue to have postnasal drip. That's part of the delayed response that comes on because of some of these other inflammatory mediators. So the next thing to add would be a nasal steroid. Now, many people tolerate nasal steroids very well. The systemic absorption is small, but some people get irritation of their nose or nosebleeds or dryness of the nose from taking nasal steroids. So if you get away with an antihistamine, that's the simple plan, that's plan one. If that's not working and you add a nasal steroid, you really have to take the nasal steroid for about 2 weeks for it to be maximally effective. The next thing we consider that's available over the counter is a decongestant. A decongestant is not something that I like for my patients to stay on regularly because it is considered a stimulant. It can elevate your heart rate. It can keep you awake at night. I'll add a decongestant if I think you're turning into a sinus infection, or if I think we can short-term use it to decrease the acute reaction until we can come up with a better management plan. So a decongestant is good at treating nasal congestion. A nasal steroid is good at treating nasal congestion. But for the itchy, watery eyes and sneezing, it's an antihistamine. Then there's another really simple thing that we can use to improve our allergy symptoms, and that's sinus irrigation. And I know it's not most people's favorite thing to do, but if we rinse our sinuses with saline, it physically dilutes the antigens that you're breathing in, and that can help to decrease this whole response that's happening on the inside. So I'll often say it's a small thing that you can do, like washing your hands or taking a bath, that decreases the load that your body has to deal with. So if you know that you're exposed to something that's going to cause your allergies to be exacerbated, rinsing your sinuses just makes less of a load that your body has to work on. Certainly if you've tried all these things and you're still not having improvement, that's typically the patients that will present to our office. Another medication that we often use for allergies is a leukotriene inhibitor called montelukast or Singulair. And Singulair is something that we have used for years and years. Most recently, we did receive a black box warning that in some patients, Singulair can cause significant side effects such as mood changes and aggravation, irritation, sleep disorders, depression. So it's not something that we use first line, but it is still a very valuable medication because it treats one of the inflammatory mediators that aren't treated by over-the-counter medications, and it certainly is a great choice for someone who is having lower respiratory symptoms or asthma. Once we've tried medical management and we feel as though we're taking medications daily, or we're taking multiple medications daily and we're still having symptoms, or we don't like to take multiple medications daily, that's really when it's time to get allergy tested. So many times if you get allergy tested and we can identify what you're allergic to, we can stop this response from happening. We can stop your immune system from triggering such a large release of inflammatory mediators by building your immunity and making you no longer allergic. So it's always my preference to treat the problem instead of just managing the symptoms. But certainly from the onset, managing the symptoms is something that you can do at home. And so I just wanted to do a little review on some of the immunology, tried to make it as simple as possible, but how and when to use some over-the-counter medications. So I hope this was helpful. We are in the middle of Allergy Awareness Month, so we're just trying to highlight some of the aspects of allergies that most people experience at some time in their life, and see how we can be beneficial in helping getting you feeling better.